With sex addiction, sex becomes the most important need. And it's progressive, and you develop a tolerance to the behavior. So you need more and more of the stimulation in order to feel satisfied.
How do you know if you have it?
You're starting to have negative consequences on an ongoing basis, and you're still not quite able to give up the behavior that's causing the trouble.
Can you identify any risk factors that would make somebody predisposed to develop sexual addiction?
Childhood abuse history, a history of chronic trauma, physical abuse, neglect, other addiction.
All right, so how do you diagnose sex addiction?
I give them a screening instrument. It asks them a variety of questions about their sexual behaviors, the length of time that they spend engaging in the behaviors, the way that the behaviors affect them in the rest of their lives.
So where does self-control come in?
The addict, as the addiction develops, has the illusion that they are in control of the behavior. But in fact, as their illusion of control progresses, so does their actual loss of control in reality. Usually it takes some kind of crisis blowing up in your face for you to realize that this is out of control.
And how do you treat it?
One of the strongest antidotes is the ingredient of honesty, gut level honesty, with a trained clinician, with others who have been through the disorder, with your family members, and with yourself, most of all. The message that never gets across is that treatment is effective. Treatment itself can be extremely expensive, even with good health insurance. The 12-step programs are an excellent adjunct to professional care. You meet other people who are recovering from sex addiction there. They're going to pass on to you what's worked for them.
How do you then get back to a normal sex life?
You gradually work with your treatment team to establish what are safe sexual behaviors for me, and you start with the simplest, easiest ones. Addiction is a disease of denial and illusion and relapse, unfortunately. But with proper treatment, you can be trained to prevent relapse. And there are I've met thousands of recovering sex addicts who never relapse.